Hello everyone, myself Dr. Richa Agrawal, Assistant Professor, Dolphin Institute, Dehradun. Today we are going to study mechanics of ventilation, meaning the movements of the rib cage and the thoracic cage at the time of ventilation, that is during inspiration and the expiration process. There are various movements during the time of ventilation. These are as follows. First one is the movement of thorax during ventilation. As we know that each rib has its own pattern of movement, but there will be generalization for the movement pattern. Okay, for the respiratory process. The ribs attach anteriorly to the sternum, we all know that, and posteriorly to the vertebral bodies, the intervertebral disc, transverse processes, and they make a close kinematic chain. In this process, the thorax enlarges. In this process means the respiratory process. The thorax enlarges in all the three planes of movement during the inspiration. Okay. Second, increase in the anteroposterior dimension. There is a forward and upward movement of sternum and the upper ribs described as a pump handle movement as we described earlier. The thoracic spine extends or is straightened up, enabling the greater excursion of the sternum. Third, there will be the increase in the transverse dimension or the lateral dimension. There is an elevation and outward turning of the lateral portion of the ribs. The outer portion of the ribs will move outward towards the periphery. The lower ribs, that is the 8th rib, 9th rib and 10th rib, which are not attached directly to the sternum, they also open outward, as a result increasing the subcostal angle. Next, increase in the vertical dimension. The central tendon of the diaphragm descends and the muscle contracts. Elevation of the ribs increases the vertical dimension of the thorax and improves the effectiveness of the diaphragm. At the end of the inspiration, these muscles relax and elastic recoiling occurs, which causes the diaphragm to move superiorly. Clear? Next point is the movement of air. As we all know, ventilation is the mass exchange of gases to and from the body. During inspiration, as the thorax enlarges, the pressure inside the lung becomes lower than the atmospheric pressure and the air rushes into the lungs. At the end of inspiration, the muscles relax and the elastic recoil of the lungs pushes the air out, resulting in the expiration. Next is the compliance. Compliance means the distensibility of the tissue or how easily the lungs inflate during the inspiration. Normally, lungs are highly distensible, means they are highly compliant, but the compliance changes with age and the presence of disease. During the normal aging process, the lung tissue becomes more compliant, while if there is any disease of the pulmonary system, that is cause of the fibrosis of the tissues, the lung made rigid, means less compliant. Whereas in another condition as emphysema, it is a chronic obstructive disease. It makes lung tissue more compliant to pressures. Next thing is airway resistance. Airway resistance means the amount of resistance to the flow of air through the airway depends on number of factors. For example, the size of the lumen, diameter of the lumen. The size of the lumen influences the resistance. It can be increased by mucus or edema in the airways or the contraction of the smooth muscles. Normally, the airways widen during inspiration and narrow during the process of expiration. As the diameter of the airway decreases, the resistance to airflow increases. In a disease that cause a bronchospasm, for example in asthma, or where the mucus production is increased, for example in chronic bronchitis, the airway resistance is greater than normal, especially in the expiration process. Next point is the flow rates. Flow rates indicates the measurement of the amount of air moved in or out of the airways over a period of time. Flow rate are also altered as the result of diseases that affect the respiratory tree and the chest wall. For example, in chronic obstructive pulmonary disease, the expiratory flow rate is decreased in comparison to normal. That is, it takes a longer than the normal amount of time to exhale a specific volume of air. Next, we are going to discuss the classification of breath sounds. Breath sounds are the sounds which are heard by the stethoscopes. These are classified by location, pitch, and intensity, as well as the ratio of sound heard on inspiration and on expiration. Breath sounds are classified into normal breath sounds and abnormal breath sounds or adventitious breath sounds. Normal breath sounds occur in the absence of any pathology and are heard predominantly during inspiration. These are categorized under three categories: vesicular, bronchial, and bronchovesicular. Vesicular, it is soft, low pitched, breezy sound heard over the most of the chest except near the trachea and near the principal bronchus and between the scapula. In these three areas, this sound can't be listened. Vesicular sounds are audible considerably longer on inspiration than the expiration. Next sound is the bronchial sound. It is loud, hollow or tubular, high-pitched sound heard over the principal bronchus and the trachea. Bronchial sounds are heard equally during inspiration and expiration, with a slight pause in the sound occurs between inspiration and expiration. Third one is the bronchovesicular. It is softer than the bronchial breath sound, also heard equally during inspiration and expiration, but without a pause in the sound between the cycles. It is heard in the supraclavicular region, suprascapular region, and the parasternal region anteriorly and between the scapulas posteriorly. Now coming to the abnormal breath sounds or adventitious breath sounds. Two breath sounds are there: crackles and wheezes. Crackles are basically fine, discontinuous sounds. They can be fine or coarse and are heard primarily during inspiration as the result of secretions moving in the airways or in the closed airways that are rapidly reopening. Wheezes, it is continuous high or low pitched sounds or sometimes musical tones heard during exhalation but occasionally audible during inspiration. Bronchospasm or secretions that narrow the lumen of the airways causes the wheezing, especially at the time of asthma. Next, we are going to deal with goals of breathing exercises and ventilatory muscle training. Main goals are to improve the ventilation process, to increase the effectiveness of the cough mechanism and promote airway clearance, to prevent any post-operative pulmonary complication, to improve the strength, endurance and coordination of the muscles of ventilation, to maintain or improve the chest and thoracic spine mobility, to correct inefficient or abnormal breathing patterns and decrease the work of breathing, to promote relaxation and relieve stress, to teach the patient how to deal with the episodes of dyspnea, improve a patient's overall functional capacity for daily living, occupational, and recreational activities. This is the introduction part of the breathing exercises, ventilation process. Now, in the next class, we start with the types of breathing exercises, how the breathing exercises can be done, what are the preparation to be done for breathing exercises. So, see you next. Bye bye. Take care.